Good morning, guys. It's Dr. Mo. I am so tired of talking to patients about logistics and pharmacies and temperature and all that goodness. And I saw a TikTok yesterday about a physician I respect, obesity medicine physician I respect. She was talking about how many years she spent counting points, just struggling, working hard. And then I saw a post last night about vanity use of these medications. And if you've heard me before, you know my stance on that. But I'm going to say it again because I've been thinking about this from a personal standpoint for the last couple days. Here, while we're here, say hi to the dog. He's a happy dog. Picked him up a day early from boarding. So, and I had someone text me this morning that he's got a hernia, and he'd been toying with the idea of starting the medications anyway because, he can't lose weight on his own. I've been working with him for over a year. And anyway, so there's a lot of things that are coming up that are just showing me that, it's not a cop-out. I guess maybe it is. I don't know, right? I can only speak for myself. I always get on here and I talk about my experience as a patient first. And I haven't been doing that lately because we've had so many pharmacy issues and crap. I'm just tired of it. So we're going to have some coffee and we're going to talk about year 2 of my successful long-term weight management journey, right? Because it's not a quick fix. It's not a diet pill. You have to do some work. And as most of you know, I am completely transparent. I'm 80-20. Well, I probably shouldn't say that. I almost said I was 80-20 when my diet's crap. It's probably not quite that bad, but I feel like it's that bad, right? And perception is everything. So, but year 2, moving into my weight is fine. My body has settled in. It knows where it wants to be. It's like, no, I got this. I'm good. My food quality really needs some improvement. So how do I do that? I don't know yet. But the whole point is, I do know how to do it, right? You meal prep, you make sure you have good food in the house. I'm going to get groceries today. For me, it's about having quick options that are easy. I got up later than our son this morning and I actually woke up to him saying, I made my own breakfast. I'm like, good. Necessity is the mother of invention. And he popped a Kodiak cake muffin into the microwave and cooked that, which was great. Got a little bit of protein in it. We're out of milk. So there's that. Twice in his little life there, we've been out of milk. Not a catastrophe, but how do you change your diet quality? Well, the first thing about changing anything in your life, right, is you have to want to change. Are they Maslow? No, it's Maslow's hierarchy of needs. Psych 101 was a long time ago. But it's the stages of change, right? Pre-contemplation. You don't even realize there is a change to be made. I'm so dehydrated. God, you can see it in my face. There's another thing. Pre-contemplation, the contemplation stage. Well, I know I need to change. Okay. And you waffle. And then you've got, when you actually start to make change. And that's what we work on with our patients is practical change. Right now it's a lot of my medication arrived warm. They said I should freeze my medication. Don't do that. I don't know what the hell is going on, but I'm so tired of these things. I want to talk about the things that matter. And I get it, these matter, but this isn't just about medication. This is about behavior change. This is about life change. This is about getting a life back. I use quotes because I use syllabic quotes there. But I use quotes because I didn't get a life back. I was given a life I never had. I was given a life I always dreamed was out there, but I didn't know how to get it. So people say, it's not a magic pill. People joke that I'm a Mounjaro addict. No, I'm just addicted to having a freaking awesome life. That's all. You know? It's not, if you told me I couldn't take it ever again, say I came down with pancreatitis and like I couldn't take it. Okay, well, let's see what happens. Because the lack of food noise for me, it's a mental health drug. I'll be honest. You know, I've talked about this before too. But when I look back and what this other physician on TikTok said, and we're having coffee together, about how many years wasted. Informative years for me. You know, I first started dieting because my food felt out of control. Well, the first time my food felt out of control was around age 9 or so. I started dieting at 11. I'm turning 50 this year. So for people to say to me, you took the easy way out, I can't say anything for anybody else, but I didn't. It was actually pretty hard to accept the help. I don't accept help. I am but getting better, but I don't accept help very well. And everybody has a story, and I'm not forcing anybody to take medications. My ultimate goal is to get people enrolled with our services, just like you would any other personal trainer or nutritionist out there that doesn't work with the medications, you know, like Noom did or whatever, because our community is valuable, our education is valuable, and we happen to offer a service, right? It's obviously an important thing since Weight Watchers and Noom said, oh, we need to do this. Yeah, because it increases your success rate. Even if it's allowing someone the space for 6 months to help retrain your brain, redo your habits, it just takes you out of that cycle of trying and failing, right? I'm pretty successful in a lot of areas in my life, and I work hard. Right now I'm working hard to pay off debt that part of me is like, I should have done before, right? My favorite saying is, when's the best time to plant a tree? God, could you imagine if we'd have these drugs 20 years ago? I actually wonder what it would change in society. But, you know, no use in wondering. Just do what you can today. I don't look down on people for taking the medications. I don't look down on people for not taking the medications. Everyone has their own journey. You know, I was talking to a really good friend today, and they're having kind of a crisis of perspective. They feel like they're trapped. You know, they have a lot of expenses. They feel like career-wise, they're not doing what they should be doing. And I know this person is extremely knowledgeable in this certain area, and the world needs to hear what they have to say. But until they see that, you know, it's that pre-contemplation thing. Until they see that, it won't change, right? And that's, here we go. This idea percolates a lot in my head. I work with my business coaches on becoming an expert, you know, and I kind of know I'm an expert, but if you were to ask me what I'm an expert in, weirdly, it's not long-term weight management. I've only done that for a year. I'm an expert in showing people that life doesn't have to suck. How do you say that in a TED Talk? I don't know. We'll get to that. So thanks for listening to my banter. It's like Sunday coffee on Saturday. I appreciate every one of you out there who's liked and subscribed. If you haven't, please like and subscribe. I appreciate you. Oh yeah, I forgot my medical disclaimer. I'm not your doctor, right? I am a doctor. I'm not your doctor. Even on here, if I am your doctor, I'm not your doctor. YouTube is not a place where you receive medical care. Neither is TikTok or Facebook. Those are social media platforms. They're fantastic for learning. I listen to YouTube all the time, all about my Simon Sinek moments. I got a few people that I listen to quite often. But this is not the place for medical care, right? And, you know, we're just trying to change our little corner of the world. If you need us, oh yeah, I got Virginia. So now I'm not going to be the primary provider in Virginia, but what it does allow me to do is get Amanda Luby, a new nurse practitioner. She's going to be out there. She's doing all my Virginia. So one more state, check. Only waiting on Michigan, but Dr. Laura Galdamez has Michigan, so we're good. I just did that because that was a state near and dear to my heart for my peoples. So, all right. On that note, I'm going to go get back to work.